Hello YouTube and welcome back to my channel Living with Disabilities. Today I'm going to talk about my journey with dystonia and how did I get the diagnosis, and I will also be talking about how long it took to actually get this diagnosis. So my original diagnosis was at birth. I was diagnosed with congenital hydrocephalus, meaning that I have this since birth. It was not because of trauma to the head. It was just I was born this way, like Lady Gaga says, and that was it. That was the only chronic condition that I had at birth, and I managed to live a fairly good life with some ups and downs in my childhood and teen years. And then up until 2016, my life started to change and it started to get worse gradually, almost steep decline, not gradually, but it was more like a very steep decline. And I talked about how I had my first seizure in 2016 while I was going to the hospital for having complaints of fatigue, nausea, headaches that started happening, and they were so severe that as a hydrocephalus patient I need to get the proper medical care for this. So I had a seizure and I had headaches and I had this weird thing happening in my body, which is having the stiffness, and it was different from my seizures, where my tonic clonic seizures, where I would lose consciousness and I would go through the two phases of tonic being stiff, and then I would have the tremor, the clonic stage. So this was different. I was aware, I was there. It did last more than a couple of minutes. Sometimes it would last for like 20 minutes. Sometimes it would take 20 minutes and and it would a little bit improve and then it would go back again. So it might be very lengthy to just have this stiff arm or stiff neck, or sometimes an arm and a neck, sometimes full body, sometimes it's just a neck. So this started happening, and at that time my seizure activity was extremely bad. It was so bad. I was back to the hospital almost every couple of weeks because of either a very bad headache that I'm having, and I cannot just sit home and guess if it's just a headache or a headache that needs medical intervention. And also my seizures were so much that I got a lot of bruises, traumas to the head, and I would go to the hospital. Sometimes I would be hospitalized for my headache, and within the hospital stay I would have a seizure. So I was having a lot of seizures, and I was still not diagnosed back then with epilepsy, and they started me on clonazepam. So clonazepam, it did decrease my seizures, and when I understood how this medication works regarding it being used as a rescue medication, which means that when I'm having the aura, the feelings before the seizure, I would put a clonazepam pill under my tongue, and it would almost abort or let the seizure happen with less severity and less damage. So this was happening, and then the other symptoms that are the cramping and the stiffness, and they started kind of subtle, not so bad. They were first tingling around my mouth and my face, my jaw and my hands. Sometimes I would feel like my hand is going heavy. Sometimes it would start tremoring, but it would not be so bad. And then my left leg would start shaking, but I would look like somebody who's nervous about something, and they're just like doing like this with their leg, but I'm not doing it on purpose. So that was weird, and because it was subtle and I'm the one feeling it, nobody noticed anything except for the seizures. So my epileptologist one day told me, I don't think what you have is actually related to epilepsy, but let's see if this is a type of another type of seizures that you're having, in addition to the atonic clonic seizures that you have. And I was like, okay, let's look into it. And the EEG showed no electrical wave, but it did show rhythmic. I'm starting to have stiffness, sorry. It showed rhythmic movements in my body. Even though it's not always rhythmic, it can be like weird and sudden changes, but I did see that on the waves mostly. So my doctor suggested that I should see a movement disorder specialist, and I was like puzzled, like, why? I already have this extra diagnosis of epilepsy, and now you want to add another thing. Shit. So when I was talking to my epileptologist, he's Russian, and he speaks 5 languages, I believe: Russian, Arabic, Hebrew, and another two things, I'm not sure what, German and another language. So we were talking in English, and he was writing the report both in English and in Hebrew. So I was like, okay, I'm going to make an appointment with the movement disorder specialist, and let's look into this. So I went to the office, and I was like, I need this appointment, and it was written in English, and they were like, we don't understand English here. I was like, okay, how about Hebrew? How do I put this to Google Translate? And they're like, no, we don't do that here. I'm like, okay. So I took a number, and I had to wait for an hour to see a family doctor to tell me what's the name of movement disorder clinic or specialist in Hebrew. Even the family doctor couldn't tell me. So I was like, okay, I'm fucked here. Fine. So back to another hospital stay. A lot of hospital stays regarding headaches, regarding seizures, regarding spasticity that started getting more severe. So one day I was in a hospital, and they asked a neurologist to come for consultation. And this neurologist, they did all the neurological testing: move your hands up, down, look up, look right, follow my finger, touch my finger, touch your nose, etc. So she looked at my body, and she took a lot of time, this neurologist, the first time that they wanted to really tackle this in depth. And so she came to my room in the hospital, and she did like a very full evaluation of my body and how it's actually responding to passive movements, how is it responding to me when I'm moving it, etc. So she saw that I do have what she said, her words, increased tone and the muscles, but she did not give me any diagnosis at that time. And she wanted to talk to my neuropsychiatrist at that time, and she was like, this is probably psychogenic. It's like, okay, fine. And then this continued, and it started getting more and more disabling, to the point that I started dropping things. I started losing a shitload of weight because I cannot swallow like I used to do. I cannot hold spoons or cups or or chop things. I don't cook for myself anymore, like at all. And sometimes I don't even know how to make myself a sandwich, and when I do, it's hard to eat. So fast forward to another hospital stay regarding my headaches and seizures, and they were unable to help me with my headaches. They were like, okay, you're above our expertise, you're going to a different hospital. But they did consult a movement disorder specialist. So that was the first time that I got diagnosed, and it was after 6.5 years of being hospitalized and going to outpatient clinics back and forth, and doctors seeing my dystonia in my face, in my hands, in my legs, the way I talk and speak, and they are noticing that I'm losing weight. So I was diagnosed after 6.5 to 7 years in the hospital. So it was not a regular movement disorder specialist appointment. So he was confused, and I told him this happened. It's just bureaucracy, and I could not go to the appointment because of this. And when I got the appointment, when I finally got what this means in Hebrew, and I got the appointment, it was 15 months away from the time that I took the appointment. A year and a half. A fucking year and a half of more waiting. So this doctor was shocked when I told him about the waiting list. So he diagnosed me on spot. He told me, you have dystonia on the left side back then. And he suggested having a Botox injection. And that was it. And it was like a follow-up with my clinic. And then another hospital stay. At this stage, I was only concerned, my top priority, to actually understand what is going on with my BP shunt. If it's malfunctioning, it needs to be fixed, and that's my top priority. And I will not be looking into anything except unless this is fixed. So I was hospitalized again in a different hospital this time, and still having headaches, still having seizures, a lot of seizures, still having dystonia more than before. And then the second time, this doctor comes, and he was like, okay, I'm just looking at this, and it says that you've been diagnosed with dystonia. I may not agree with this diagnosis. It may be your shunt is overdraining. I was like, yay! So I don't have this chronic, no cure disease. It's just an overdraining shunt that can be fixed with the surgery. Yay! Fabulous, you know. And then at the time of the discharge, I was kept for observation. He wrote in the report of the discharge that I have dystonia on the left and on the right side. And I was pissed as hell, and I was crying. I was sobbing. It was exactly a year before this day, exactly the same time. I was sobbing like crazy. It was also around the Jewish holidays, and I was sobbing like crazy. It was 3 a.m. and I was crying so loud because I was still not able to get answers. My shunt was still the same device, and they were unable to tell what to do with it. My seizures were out of control. Dystonia also out of control. Another hospital stay. So this doctor says, okay, let me test you again. And of course he went through my my history, and I did tell the other doctors who saw me. I've seen several neurologists, so those are not the two only neurologists that I've seen, but those are the ones that I remember. But those are not the only ones that I've seen. However, other neurologists also suggested dystonia, but every time they would be diagnosing an organ and then adding another organ and adding another organ. So the last doctor that I've seen was within this hospital stay 3 weeks ago, when I was going for my VP shunt replacement. He was asking me about dystonia, and he was doing all the neurological testing. Move your hands in the air, touch this, touch that. Within a couple of seconds, he was able to tell that I have generalized dystonia by now, and that was written in my report. So it took 7 years of rotten bureaucratic system to get me this diagnosis. But this is not one story. This happens a lot for people with dystonia, because it can be mistaken for other diseases, and people can be on drugs that they don't even need for this, or it can be just brushed aside like I did in the beginning, because I didn't know where or how severe it can get or what to do, and I thought this is also seizures happening in a different form, so how would I know? So it took 7 years, and those years I was not under I was not taking medication to actually manage my symptoms. And the symptoms of dystonia, for those who don't know what dystonia is, it's cramping, severe cramping and stiff, like you're pulling a muscle. It's exactly like this. I'm not able to actually fully open my hand. Even if I am going to try with my good hand, it actually hurts so bad. I actually forgot what I was going to say. Anyways, so it took 7 years, and at that time I was not having medical supervision or medication to tackle this. So I was only recommended physical therapy only recently after the surgery, and I did have all physical therapy before, but it was short sessions, and I could not attend because it was the corona at the time, the pandemic, and they did not have the vaccines. It was very chaotic, so I did not go, and I wanted to stick home, stay safe, and try to move my hands as much as I can, while keeping in my mind what my doctor told me. I'm not actually having a doctor to supervise me until this moment, because I kept moving from hospital to hospital to hospital, from one patient clinic to another patient clinic. So until this moment, I still haven't seen in an outpatient clinic a specialist who knows me well and who knows my case and is following up with me. However, I've seen a private doctor, but I cannot afford to have this private doctor at all time. And he was the one to give me the full diagnosis, but I'm not following up with him, which is the general dystonia with vocal cord dystonia and difficulty eating, dystonia on all four, and cervical dystonia, also facial muscles. So this doctor, private doctor, he also suggested Botox injections, but I'm not really happy about this treatment, and I don't think that I would go for it, because this includes having injections in every affected muscle, and I do have I have it in my hand. You can see that this is spreading actually, even though you cannot see on the cam. The spasticity has spread all the way from my hand to my shoulder to my rib cage. So anyways, this Botox injection, I do not agree, because they will be injecting every muscle. So imagine if they will be injecting every muscle in one hand, this hand, how many injections would I be getting? And this would be every month, every 3 months that I need to do this again. And I told the doctor, I was like, can't you see that this is extremely invasive? And he was silent because he felt that this is not the way to do it. And in my opinion, even though I haven't seen or been committed until this day to physical therapy, to a movement disorder specialist who is actually supervising my case, I feel like it would be best to go for either baclofen for medication, which is also like a muscle relaxer, like a clonazepam, I think, and or either I would go for baclofen pump, because currently my life is extremely damaged by dystonia. Is like in the morning I had tremors in my neck, and you all know by now I have stitches exactly. This is how big my incision is, exactly. This is how big it is, exactly like this. Can you see my fingers? It's exactly like this. I think it's around like 50 stitches, maybe more. They did very rough stitching. So I did have tremor in my neck in the morning, and just imagine the scene, how bad the neck can go all the way to the left and then start tremoring. Oh my god. And then it would start tremoring, and it triggered all the stitches and the incision inside in my head to ache like crazy, and that provoked the most hideous headache ever. But I do understand this headache is not coming from hydrocephalus. It's coming from this cervical dystonia that I have. Actually, I don't know what I just said the whole video and how long it is, and I hope this is understandable. But what I was trying to say is how long it took for dystonia to be diagnosed, and it has no cure. So I feel like, what's the point even if you caught that early on? So what's your point? You still can't cure this. It's 2022 and we still don't have a cure for this. It's still 2022 and hunger is still the first killer on this planet. So yeah, dystonia is not the worst. So anyways, YouTube, this is my video. Looks like I'm very gloomy today. Not only my room is gloomy, I'm gloomy. So I'm sorry for my face, for my my jaw being moved. It apologizes to you, and my hand is apologizing. I'm sorry for the scene. I'm sorry for not being for being so chaotic today, but I just needed to verbalize this. So I'll see you when I see you, and goodbye, YouTube.